Hi, this video is to answer the 5 most common questions that people ask me about what it's like to start therapy. The first most popular question is, will what I say in the session stay private? And I'm very glad people ask this question because the truth is, not necessarily. There are what we call limits to confidentiality, and your therapist will explain these limits to you before you start working together, but just so you know ahead of time, I'll explain them too. First and foremost, if you say you're going to harm yourself or someone else, we have to break confidentiality and tell the proper authorities. If you say, I'm going to commit suicide or I'm going to beat up my boss, we have to tell people, including your intended target, your boss in that scenario. Additionally, if you talk about committing child or elder abuse, we are mandated reporters. We are legally and ethically bound to report those abuses. So in those situations, yes, your confidentiality will be broken. I want to clarify, however, that if you are discussing being the victim of child or elder abuse, then no, we will not report that. That stays private. It's only if you are the person committing the crime, the perpetrator. Something sort of in line with that question is people asking me about whether or not they should use their health insurance to pay for their therapy. The reality is that yes, your therapist keeps notes about what goes on within the course of your sessions, and if you're using insurance to pay for it, your insurance company may want to see those notes so they know what they're paying for. And yes, if you get your insurance through your employer, the benefits department may see the notes that the insurance company has. So it's possible that this is not necessarily the most private way to receive therapy. Know that going in, discuss it with your therapist. A lot of private therapists will offer payment on what's called a sliding scale. So discuss that with them as well. See if that's possible. And what that means is that they won't charge you their regular flat fee. They'll charge you out of pocket based on what you can afford. So that's an option. Again, if you want to pay out of pocket, no insurance company is involved, your employer won't know what's going on. Question number 3 is about medication, whether or not starting therapy means you'll have to go on drugs. No, I mean starting any sort of treatment doesn't mean you'll have to go on medication. Even your medical doctor can prescribe medications, but you still don't have to take them. The reality is that sometimes, yes, medications will be recommended to you and prescribed to you. Advocate for yourself. Find out what they're for. Find out how they're supposed to be taken and take them as directed. Just have an open line of communication with your therapist about why they're suggesting medication and how it's supposed to work and how you're supposed to use them. You don't have to do anything, but you're going there to get better, and if medications are part of the treatment, it's something to explore. Number 4, people ask, will I be committed? Will I get sent to the hospital? If you are a clear and present danger to yourself or someone else, and hospitalization is the safest thing for you, yes, but that's about the only scenario that will happen. Finally, this is sort of a less intense question, but people want to know, I don't know what I'm going to talk about once I get there. This is the thing. Just say that. If you're going because you have an issue that you want to sort of resolve or a problem that you can't fix on your own that you want to talk about, start with that. If you're going, as a lot of people are, because someone else is asking you to or demanding that you go, maybe someone in your family, maybe an employer, a partner, start with that. Say, okay, I'm here because my sister wants me to be here. I don't see the point. I'm not really invested. That's still starting a conversation, and that's what psychotherapy is. It's talking. So now you have all the answers to those questions. If you have any more questions, I would really be happy to answer them. So please just send them to me. I'll get them answered as soon and as effectively as I can. Thank you for watching, and take care.